You have a 20-year-old male who came to the clinic with a history of stuffy, runny, and itchy nose for the past 2 days. Okay, he has noted yellowish and greenish discharge today. What antibiotic will you provide to this patient? Doctors, what will be your answer? What antibiotic will you provide to this patient? Who will help me? What antibiotic will you provide to this patient? You have a patient, beautiful. Dr. Saleh, beautiful. Dr. Saleh says no antibiotic. I just want to show you his answer so you'll understand. He says no antibiotic. Dr. Torre also says something similar. No antibiotic. This is beautiful. This is beautiful. Why no antibiotic? Because, and I'm going to show you the reason. I'm so happy. Do not prescribe antibiotics. And from RX Files, the 12th edition, page 100, it says that yellow greenish discharge is not indicative of bacterial infection. Because, you can have a patient who comes in, doctor, I'm having runny nose, beautiful. And the reason, look at what Dr. Saleh said. Dr. Saleh said it is because it is a viral infection. That is why you're not going to give any antibiotic. Okay? And Dr. Torre Pamir Popal also says the same thing. It's a viral infection, and therefore I'm not going to provide any antibiotic. This is awesome. This is awesome stuff. Great class participation. So, that same patient who has a stuffy nose, runny nose, itchy nose for the past 2 days, he has noted yellowish and greenish discharge today. What treatments will you recommend? We've learned that we're not going to give any antibiotic, but what treatments will you recommend? List 2. What treatments will you recommend? List 2. What treatments will you recommend? You can recommend decongestants. You can recommend saline nasal irrigation. You can also recommend steam inhalation. So you realize that part of these treatments, some of them are non-pharmacologic, others are pharmacologic. Okay? So, you know what, doctors, we are here to support. And I know that, look, it can be daunting. Like, to cover this book within 3 months or 4 months can be daunting, right? Compendium of Therapeutic Choices. What if I told you that we've reviewed everything, every page? Every page of this book has been reviewed for you. Every page of this book has been reviewed, and we have reviewed the most important concepts. And it's not just this book. We have reviewed, the RX Files as well. We have reviewed all the topics and all the things which are in the 105 priority topics, right, on the CFPC, because that is what the Medical Council is advising that we should do, right? We've reviewed all those things for you. And all you need to do is, whether it is the mock exam or it is the learning, all you need to do is to just plug in. There's no need for you to reinvent the wheel or anything. And you get all this done for you for only $1,200. Only $1,200, 1,200 Canadian dollars. Okay, only 1,200 Canadian dollars. So I'll be dropping the comments in the comment section on Facebook and YouTube. I'll be dropping the link there. Those who have or who want to join us, awesome. We are ready to take you. Okay, so I'm dropping the comments in the comment section on Facebook, and then you can use that checkout to just register. And I'll be dropping the comments as well in the comment section on YouTube as well. Okay, on Facebook and YouTube. It's only for 1,200, 1,200 Canadian. And we're going to be by your side, work with you, prepare you thoroughly till you get into your exam and ace this very important exam. So, doctors, I just want to ask, if anyone has any question, you can just ask, and then we'll make sure that we answer your question. So if you want to register, how can we book the exam, please? So the exam, the TDM exam, you need to be invited for it. You cannot just book it. So, for example, if you've written your QE1 and you've applied to the College of Physicians and Surgeons of Alberta, or you've written your QE1 and your NACOSCI, and you've applied to the College of Physicians and Surgeons of Saskatchewan, okay? When they start processing your documents, then they will send you an invitation that, hey, doc, so this is the question the doc is asking about. Dr. Lamie Ezini says, how can we book the exam? How can we book the exam? So that one, you need to be invited. Okay, so she's thrown some more light on it. She says, I mean the MCCQE1. So for the MCCQE1, you need to create a physician's apply account. Okay, so I'm going to put it in the comment section. It's called physiciansapply.ca. Okay, so if you create a physician's apply account, that is where you can do your registration. But this TDM is not the MCCQE1. TDM is an exam on its own. It's called therapeutic decision making. Okay, yeah. So he said, how can we book the exam? So you can book it through your MCC